Well, some physicians are still reportedly forcing HIV-positive patients to get sterilized or to sterilize. This, they say, is an attempt to reduce mother-to-child HIV transmissions. The practice, which is considered a violation of medical duty, is still rife in countries such as South Africa, Namibia and Chile. Let's talk about this now with the SA National AIDS Council's co-chairperson, Steve Letsike. Steve, a very good evening to you. Thank you for your time tonight. The conversation about forced sterilization of mothers in South Africa has been going on for several years. I remember the Commission for Gender Equality, in fact, a few years ago released a report, and even then it came with the caveat that because of how this happens, we don't even have a full sense of just how widespread it is.
No, thank you so much, and really good evening to the viewers of Newzroom. Indeed, the conversation of addressing forced sterilization has been going on for years. I think for us as the South African National AIDS Council, we've been very clear in terms of, understanding why it's necessary to consult, why it's necessary to get concerned, but also why it's necessary to engage women living with HIV, because predominantly, the forced sterilization, which of course it's implemented across board, but has been really affecting women living with HIV. And for so many years, one has been seeing a lot of stigma, discrimination, but also human rights violation, in this case. And as you know, that the Department of Health is one of the stakeholders of the South African National AIDS Council, where we've had deliberately this discussion about what it means for women living with HIV. It cannot be used as a measure to take away the women's agency, but also as a measure to really partly look at, how we prevent mother-to-child transmission. We know we have proven it differently. Treatment works, and you do not have to really take away the sexual reproductive system of women living with HIV.
But how do we fully address the problem, Steve, if we don't know the scale?
Look, what we know is that there has been reports, and not only is the CGE report that came out, you would understand that there's been organizations that have tabled this before. Her Rights Initiative, Positive Women's Network, even AIDS Legal Project, even in the past, have documented so many aching years, this human rights violation, and have taken it across. What we have seen, there has been improvement over years where medical doctors have been, have been addressing these elements and really not taking away that agency. So the scale is understood based on the reports that are happening at facility or hospital level. And I think we must understand that part of why we have these reports, what CGE, what women living with HIV, what these initiatives have been calling for, it's a justice element of how do we redress, how do we repair these injustices that have happened against women living with HIV.
Right.
So the notion around the scale is really about how we repair what has happened, and also how do we prevent the violation from continuing. Our National AIDS Council strategic plan is very clear around human rights and element, but also it's very clear about how we prevent the very same HIV epidemic that we've seen, even for children purpose in this case.
But it's also not a coincidence, is it, that most of the women affected are largely poor?
It's not a coincidence. Look, I think we need to first speak about how we have translated our own constitution, and chapter 2, which is the Bill of Rights, for many South Africans who do not understand their rights. Now, how did we translate the education element? How do we translate the accountability element? And really what affects a lot of women here is those who do not know, those who are vulnerable, and who are really subjected to these very same human rights violations. And indeed, the poorer you are, the more you are likely to be experiencing these challenges. But I think what we've seen from civil society, what the department have been doing, it's really to start up in making sure that they address the issues and the human rights violation that happens at hospital level. Some of these cases have been even taken through to the the National Health Council in terms of addressing it, but including the Health Professional Council in terms of taking the issues seriously. Where have we found our health professional really going beyond their duty of call, which is the ethical element of it?
But also, lastly, Steve, it's one thing to deal with the ethical violations, but surely at some point there need to be even perhaps criminal consequences for people who do this. We had on the channel this morning, speaking to Michelle Craig on AM Report, a woman who was in tears because she was also forced to sterilize and has been robbed of the opportunity of growing a family, a desire that she deeply holds still to this day.
Indeed, I must tell you that, look, our constitution is very strong and we always have to test it. Where there is a human rights violation, a case needs to be reported. A woman who has been subjected to this horror has to be protected, and justice must be seen, or a redress must be experienced. We cannot deny women who are violated by virtue of forced sterilization their right and their justice. And indeed, what we say is that those who act out of their scope of work by violating others and not getting concerned, they are more likely to be charged. And that's the kind of accountability we want to see, and we want the protection that it does not continue for others as well.
Steve Letsike, good to speak to you. Thank you so much for your time.